My presentation is entitled Impact of Brown Fat Activation and White Fat Browning in Obesity After Lifestyle Modification. So this was a pilot study that we did about a year and a half ago, and we would like to share what findings we got and the potential that lies behind lifestyle modification as a way of activating brown fat or inducing beige fat in a bid to treat obesity. So just a little background. We all know that obesity and its comorbidities have become a major public health concern worldwide. And the obesity is a pathological condition that is driven by energy imbalance, and this presents with increased or accumulation of adipose tissue. But adipose tissue is divided into two categories. So we've got the white adipose tissue, and then you've got the brown adipose tissue, and to a less extent, you have got the beige adipose tissue. And it's important to highlight here that beige adipose tissue is basically embedded or mixed within white adipose tissue. But it resembles the functionalities of brown adipose tissue, even when its origin is from white adipose tissue. So unlike white adipose tissue, brown adipose tissue to a large extent and beige adipose tissue to a less extent, they contain a lot of mitochondria. They are highly innervated with blood vessels, and they have small capacity of fat storage. And they also contain noradrenergic fibers. And they equally express uncoupling protein 1, which initiates thermogenesis in a quest to maintain body temperature without the need of shivering. So this is what we get in terms of UCP1. So brown adipose tissue release a lot of high percentage of UCP1 as compared to beige or bright adipose tissue, and while white adipose tissue does not release any UCP1. Now, due to the inherent capabilities of brown adipose tissue to generate heat, it has become an interesting tissue to be studied in a quest to find a novel potential treatment of obesity and metabolic disorders. We, like our previous presentation, I think the prof mentioned very well on the role of what diet and nutrition and food molecules can do to overcome weight. So lifestyle modification is one such intervention that can be used to treat obesity. But these interventions have scarcely been focused on BAT or brown adipose tissue and induction of fat browning in humans. So it has been used for treatment, but not necessarily considered on what effect or impact that they may have on brown fat and white adipose tissue. So we know that in animal studies, especially the mice, it has been shown that these weight control strategies can induce brown fat or beige fat and can activate brown fat, but the evidence is limited in humans. So as I mentioned, that the evidence is limited, but again, it is not too clear on what could be the long-term clinical efficacy of anti-obesity treatment via the activation of brown fat or induction of brown adipose tissue. Now, we know that at the moment, there's evidence showing that MRI can detect brown adipose tissue, and that in adults, the BAT intrinsic contrast mechanisms are used to determine the presence or the absence there of brown adipose tissue. As we earlier mentioned, that brown adipose tissue has very small lipid droplets, and this on MRI is manifested as low fat fraction in brown adipose tissue than it is in white, because this has little small lipid droplets, and this one has huge ones. And then there's a lot of iron that is present in the mitochondria, and this induces magnetic susceptibility on MRI, and therefore it is represented as a reduced or low T2 star value or relaxation time. We have also shown that brown adipose tissue is quite rich with a network of blood vessels, and therefore it has high oxygen consumption, and the highly metabolic activities therefore follow. And these induce a lot of magnetic susceptibility, and on MRI, that reduces the T2 relaxation time. So therefore, the T2 star and the fat fraction are an indirect measure of a brown adipose tissue or white adipose tissue metabolic activity. As we can see that the lower the T2 star and the lower the fat fraction is an indication of high metabolic activities in these tissues. So we undertook a pilot study to assess whether weight loss induced by lifestyle modification program can activate brown adipose tissue or induce white browning in morbidly obese subjects. And the second aim was to assess the beneficial impact of brown adipose tissue activation or white adipose tissue browning on metabolism in morbidly obese subjects. So we looked at adults in Hong Kong here who were morbidly obese, and it was a longitudinal study using the control group as a control as it is to compare with the LMP group. And we did the recruitment between March 2019 to February 2022. So those that were recruited for the LMP program, they needed to commit to good compliance. And the strategy was basically to induce weight loss to about 8 to 10%, reduce carbohydrates to around 50%, and reduce total fat to around 25%, and proteins to around 15%, and also increasing physical activity at least around 30 minutes 2 to 3 times a week. Just like the previous presenter mentioned about the need to have some physical activity. So they needed to have some physical activities. So we included those that were between 18 and 65 in the intervention group, and we included those that were between 18 to 30 in the control group. Now, it has been shown that the older you are, the less the activity of brown fat in you. So this is why we had to look at this age group. So because theoretically, these have more metabolic brown adipose tissue than these who are much older. And then we looked at those that were not alcoholics, and the BMI, we used the local references that at least between 32, above 32.5, and those that were in the control group had the BMI are less or equal to 23 kgs per square meter. And then in the intervention group, they needed to have non-alcoholic fat liver disease and absence of NFLD for those in the control group. We excluded those that had other kind of hepatic diseases, or those that were under medication known to affect brown fat, and all those that had non-MRI contraindications. So we measured basically the anthropometrics, the clinical parameters, liver enzymes, glucose, lipids, and these were done after 8 hours of fasting. And then we performed chemical shift encoded MRI of the abdomen, the supraclavicular and interscapular or cervical regions, basically to measure brown fat. And of course, we had to relate the cardiovascular risks with the presence and activity of brown adipose tissue. So MRI was performed at least on the same day of lifestyle modification program and after fasting for about 8 hours, not the 6 hours here. So in terms of measurements, we used an in-house method to extract a brown adipose tissue and quantifying it. So like you can see here, this is basically a brown adipose tissue fat fraction image. And this is brown adipose tissue T2 star image map. So where you see the areas of high intensity is indicating the presence of BAT. So we measured the liver fat using the region of interest method, where we placed regions of interest in each segment of the liver in all the 9, and then we go the average, get the total liver fat liver fat content in the liver. And then we did the same for the pancreas using the ROI method and placing each region, the head, the body, and the tail. And then we summed up, the average was used for analysis. So NFLD of fat liver was determined or defined as being equal, the presence of liver fat content equal or more than 5.5%, or fat pancreas had a cutoff of 6.2%. So above 6.2% was defined as being having fat pancreas disease. We use a non-parametric parametric tests for our analysis, and the results, we had 9 obese subjects and we had 9 health lean control subjects, of which 5 were females, 5 were males, 4 were females, or the other way around. 4 were males, 5 were females, and then we had 5 males and 5 females in the control group. You can see there was a very huge age difference. The obese group had 52 as their median age, and the BMI was 34.5 compared to 20.6. So what we found at 6 months of the intervention, and by the way, the intervention was only up to 6 months, what we found at 6 months of intervention is that there was a reduction in most of the anthropometrics and macronutrients in the LMP, but these were not significantly different from the baseline. And of course, we see that at least in the short term, LMP was unable to reach the targeted weight loss and macronutrients reduction. But when it comes to imaging, especially the liver and the pancreatic fat, it was shown that the LMP method had a significant reduction or effect on reducing pancreatic fat and liver fat, and when compared to although there was still a significant difference when you compare to the lean control subjects. So this is indicative of the effectiveness of LMP in reducing ectopic fat in the pancreas and liver. Now, when it comes to brown adipose tissue, the fat fraction and T2 star, we see a reduction in the percentage change of these parameters at 6 months of the intervention. And when we compare these new measurements at 6 months against the control group, we can see that they are not statistically significant. We see that the fat fraction in brown adipose tissue for control was 60.8%, while after 6 months we see that it was about 66% from 69% at baseline, and also the T2 star, it was 19 in the control group against the 30 when compared to the 31 that was there at baseline. What we mean basically is this, that this is one patient who we analyzed both the fat fraction and the T2 star at baseline and at 6 months. So the fat fraction images, you can see that in the white adipose tissue at baseline is different from what we are seeing at 6 months. We can see there are changes that we can see within white adipose tissue. In terms of brown fat or metabolic activity, we can see that there was limited activity at baseline, which we can see here with the T2 star map here. But after 6 months of LMP, we can see there's increased activity. In fact, increased activity and volume of the brown adipose tissue in the cervical region and the supraclavicular regions. So this indicates the possible occurrence of BAT activation, although minimal, especially when we look at it statistically. However, the metabolic activity in the morbidly obese group was similar to the control group. So when it comes to white adipose tissue, again, analyzing the fat fraction and the T2 star of white adipose tissue, we can see that there is a significant reduction in both the variables, minus 25% and minus 57%. This was quite significant. And when we compare this with a control group, we see that the two are not significantly different. In fact, you can see that white fat fraction in the control group was about 72%, but at 6 months in the morbidly obese, it was about 66%. And the T2 star was about 4.267 milliseconds. And yet at 6 months, we see it is at about 35 milliseconds. So basically, as we earlier mentioned, this assumably indicates that there's activity that is happening within the white adipose tissue, which is known as white browning or the induction of beige adipose tissue. Now, because of this outcome, we tried now to compare the T2 star and fat fraction of the white adipose tissue against the brown adipose tissue of the control group. And we found that the two variables were actually not significantly different between white adipose tissue and brown adipose tissue of our reference group, which is a control group, indicating the possible occurrence or confirmation of the possible occurrence of white browning. So we further went ahead to look at the effect or the impact on metabolism on all these parameters. So when we combined them all when we combined them and related them with metabolic disorder components, as we can see here, we noticed that they were all inversely related, indicating that indeed brown adipose tissue and white adipose tissue may have some beneficial effect on the function, brown or beige adipose tissue in combating metabolic disorders. We appreciate that the sample size is small and that we have a very short follow-up period. We actually wanted to augment the MRI findings by measuring NRG4. And neuroregulin 4 is a protein that is released by brown adipose tissue and beige adipose tissue. And it's a very important biomarker of the presence and activity of brown adipose tissue. But because of the short period of time of our follow-up, we could not see any marked differences in the neuroregulin 4 protein. So the other limitation of our study is that we have no histological confirmation. As I mentioned, that we tried to do the neuroregulin 4 biomarker, but apparently it was not statistically significant, but there was an indication that there was an increase in the production and presence of neuroregulin 4 in these patients, especially those that had lost markedly, that had lost weight markedly. And of course, this was done amongst the Chinese population, and therefore care should be taken into consideration when generalizing these results. So in conclusion, we see that lifestyle modification may be an effective method in inducing white adipose tissue browning, but seemingly with a slower effect on BAT activation. Of course, this may need a longer time to see these effects, and that the combined effect of the two, white brown adipose tissue and beige, were inversely correlated with obesity and comorbidities. Therefore, this could be a potential treatment, especially if well harnessed and well arranged. Otherwise, this is the end of my presentation. I'm open for questions. Thank you.